Okay, so today what I'm actually hoping to do is actually, hopefully we can actually be very interactive. And so there's actually a few sort of ground rules, so to speak. I acknowledge that many of you may not want to sort of answer questions or participate, and if you feel uncomfortable, just say pass and we'll go to the next person. And the other thing is that sometimes when I actually do these workshops, I find that some people are actually very comfortable in sharing some personal stories. So if we do that, just make sure that we keep it amongst the group. Okay, so today I've actually been asked to talk about parenting, education and general practice, and how it can actually help with anxiety and depression. Now, how many of you guys out here are GPs or registrars or medical students? So medical students first. Okay, registrars. Okay, so got a sort of a good mix. So how many of you guys out there actually aware that if you actually do a GP mental health plan, you can actually refer someone for focused psychological strategies, and one of those could be parenting education? Were you aware of that? Yeah. Any of you guys surprised by that, or not really? Yeah, a bit surprised. How many of you guys here are actually parents? Okay, so we've got a few. Okay, so I think that's probably what I want to highlight today. So what I'm going to do first is just to put things in context, because context is very, very important. So what I'm going to try and do is probably set up a little case for you. And Wynn is actually going to be Sarah today. I'm hoping that one of you guys will be brave enough to actually come up and do this as a short case. Any brave volunteers? Oh, there you go. I was a bit worried that someone will not put their hands up, and then I'll probably have to do it myself. Yeah, so just over here. So do you want to come up here? Okay, so do you want to just grab a chair? Yeah, so... and your name, sorry? John. So thank you, John. So John, are you a registrar or... Medical assistant? Excellent, great. Do you think I can give this little microphone to John?
We can share.
Sure. Okay. Actually, this is probably more real.
Okay.
Okay. So.
You're the doctor.
Okay. Okay. So what I want to actually do here is I just imagine this is going to be a short case. So for those registrars, this could be an 8-minute short case. Or medical students, it could be a 10 minutes probably history taking. So I just want to sort of see what your approaches are and then see how you go. So the main thing here today is that you're in a safe haven. There's no judgment here. Even if you do, if there is, that's okay, I'm backing you up. All right, so we've got a case here is 35-year-old Sarah who's stressed out. And she's presenting with, I can't cope at home with my 5-year-old son. He is having tantrums every day and I'm overwhelmed. There's a past history of stress, but no suicidal thoughts. Physically well and not on any medications, and she's living with her partner. So she's coming in to see you.
So Sarah, is this your first child?
Yes, my only child.
Okay, your only child. And what have you tried to deal with these tantrums so far?
Everything. I've tried time out, naughty corner, yelling, everything that I can think of, treats, rewards, and he's always been a difficult child from birth, and I'd hoped that it would have gotten better, but now that he's just started school, it's actually worse.
Okay, and has any of it helped at all?
Maybe I don't know, maybe for a day or two.
So short term you're having some successes with some strategies, but overall it's still a problem.
Yeah.
Okay. And is there anything that you've noticed that's changed or that might have been making it worse for him? Is there something?
School's made it worse, I think, because he's more tired when he gets home. Okay. But besides that, there's not really any changes. I was hoping as he gets older, he'd be better at controlling his tantrums, but it seems like it's getting worse.
Okay, and do you have any support from your partner or anyone else?
Yes, well, Kind of, but we have different parenting styles.
Okay.
I tend to need the structure. My partner tends to spoil them a little bit.
Okay.
So, yeah, we do differ in that. So we try to compromise, but I guess it's not really working.
Okay, and how does that work? You said it's not really working for you. How do you feel about that, the differing parenting styles?
Honestly, I don't like his style.
Okay.
And I don't think he likes mine either, but we're sort of tolerating each other's styles.
Okay. That's an interesting word, tolerating. Sounds like you're not actually very happy with it. Have you discussed this with him at all?
Yeah.
Okay, and how
We
did
fight.
You fight,
Yeah.
okay. Is that contributing to the stress at all?
Yeah.
Okay. So if you were to pick one or the other as more of a concern for you right now, which would you say? Like the tantrums, or is it the issues with parenting styles?
Well, he works, so it's really only an issue when he's at home with the child.
So is he a
and
fly-in, fly-out worker?
Sorry?
Is he fly-in, fly-out worker?
Yeah, well, he works 5 days a week. So during the
Oh, yeah.
daytime, and when I get my son home from school, it's stressful, but I can manage okay.
Mm-hmm.
But then he gets tired by the end, and then by that time his dad gets home, and then kind of do different things. By that time I just leave it to his dad. I don't deal with it because it's hard to go along with what he's doing.
Yeah, so do you feel like maybe your son has realised that there is a different set of rules if dad's home and if dad's not?
Definitely, yeah.
Okay. So you said you prefer to have a structure. What structure do you use so far? Because you said that tantrums start to happen when tiredness happens.
Yeah, so I try to get him home, get everything done, homework, bathing, dinner, everything done so that he can actually get to bed early. Because I'm hoping that the sleep will actually be better. But sometimes, my partner comes home and he wants to play with him for a bit. So that stretches out, then he gets hyped up, and then if he wants something, he won't come to me if his dad's home, so he'll go to his dad instead.
Okay, and is that what's triggering the tantrums, is the tiredness, or is there anything else?
I think the tiredness makes it worse, but he's always had probably like a bit of a difficult personality, he wants what he wants, basically.
Mm-hmm. And
doesn't let go very easily.
Okay, and what do these tantrums consist of?
Jumping up and down, shouting, screaming.
Okay.
If he goes to timeout, he screams, sometimes for an hour.
Mm-hmm.
But pretty much that.
Ever
Occasionally
any-
he throws something, but not often.
Okay, so throwing something at people, or
No.
So there's not any violence.
No.
It's mostly verbalizations.
Yeah.
Occasionally throwing things. What kinds of things?
Just
Toys,
he
whatever's
has
in his hand.
Yeah.
Yep. So, okay. And how long do the tantrums usually last for?
Depends. Usually, on average, about 40 minutes.
Okay.
30, 40 minutes.
Is that normal? Is that normal? I don't have any children. Okay, we'll stay in the role.
Apparently, that's normal.
Okay. And how often are they? Are they frequent?
They're becoming more frequent, so it's stressing me out a bit. Used to be, once or twice a week. Now it's every second day, and some days it's consecutive. So
Okay.
it's
So I don't know how to deal with this point. At this point, how,
okay.
if I knew how to deal with the tantrums, I'd go with those. Otherwise, I'd go on to ask you what you're dealing with how you're dealing with your stress.
Yeah.
Do you want this back?
Yeah.
Yes. Yes. Can I have that back?
Yes,
You
of
can
course.
Take the microphone, actually.
Okay.
Because I want to. So what I want to actually ask John is that how does he think he went? How do you think you go there, John?
I took a very much a med student approach, tried to gather information that I could then pass on to someone who knows a bit more than me.
Excellent. Yeah. How do you think he went?
I think he went really well.
Yes. Yeah.
I think he went really well.
I wanted to make sure you all heard that bit.
I think there's actually a lot of empathy there, isn't it? What I just want to highlight there is that what was the difficulties there, do you think, with parenting, where parents actually presents with, hey, can you help my child, or I'm actually overwhelmed with my child? What's the main challenges for you there, do you think?
I think there was probably 3 challenges. The first is not knowing enough about children.
Yeah.
So
Okay.
the first one. The second challenge is not knowing exactly what it is that the parent's looking for. Are they
Sure.
looking for, are they looking to vent? Are they looking for someone to listen? Are they looking for support? Are they
Sure.
looking to find out what normal is? Are they looking for resources or help? Or and then the third issue
Probably
is,
all of them.
yeah, and then the third issue is knowing how to get that in, like what information is relevant and what information I'm trying to find.
Okay, no worries. So anyone want to sort of have a feedback, any questions or feedback on that? No?
I think the thing that I find really challenging is it's such a personal and it's such a personal thing for the patient to be coming to you. You don't want to seem judgmental.
Yes.
You don't,
Yeah.
That's the main thing that
Yeah.
challenges me. I'm
Yeah.
really worried about breaking rapport or very self.
Sure, yeah. I think just probably give John an honest opinion is that his mindset, his empathy is actually excellent. So I think that's probably the key actually. Yeah, in actual fact, even if you say, look, I actually don't know much about parenting, I'm going to refer you to someone who can, I think that would have been very therapeutic. Just from that compassionate connection and where you're just listening and you're actually acknowledging. I think a lot of the times, I think doctors, GP registrars, particularly mine, we actually have about 6 in our practice. I think a lot of times I find that registrars underestimate the power of compassion, the power of just being there for the patient and actually acknowledging the patient. And actually, if anything, that's probably one of the most important things you can do. Okay, so thank you very much, John. You made my life easy then. I might just get you to take this down if you can. Yeah, I'll take that down for you. Yeah. Okay. So thanks again for that. So what I'm actually going to do today is probably trying to give you guys a bit of a framework on how to actually deal with these issues, because if you actually don't have a framework, it's actually going to be very, very difficult. I guess the other thing I'm actually going to do today is I'm not going to expect you guys to sort of go home and actually do heaps of parenting stuff with parents. But at least I think if you guys have a framework and probably ignite some of your interest to actually further train in this area, because I think it's probably the value of this is actually underestimated and underutilized in general practice. As you can imagine, that if you can actually help this mum, you probably may even reduce the incidence of depression, anxiety, or postnatal depression, and probably even broken marriages. And a lot of the times in general practice, we see people at various stages of their relationships where we actually think back and say, look, I would have liked to see you actually before you had the child. So hopefully I'm going to, in the next 45 minutes, give you a bit of framework and an appreciation of how we approach these sort of issues. So what I usually do is that in a consult like this, obviously you have to make sure that they're safe, there's no major depression, no thoughts of self-harm, and make sure that they're safe. But once they're safe, you can actually go into and actually work through some of these issues. So with every consult, there's really 3 things that I focus on. So the first thing is defining what is the problem. What's the second thing, do you think? The first thing is define, well, what's the problem here? The second thing is to identify what's their expectation. Yeah, okay. What and why? Why is it a problem? And once you know what and why, you can then know how to improve the problem. And when you think about it, every consult's like this, isn't it? It's really saying, hey, what's the problem here? And you guys will probably say, okay, that's a presenting complaint, past history, blah, blah, blah. And then the why is your diagnosis, essentially. And then how to improve it is your management. So often I find that when mums come in and they say, hey, fix my child, or I'm actually overwhelmed, help me with this stress, they're often after which one do you think? They want a solution. And often I think as doctors we are very empathetic and we can feel that pressure, and sometimes the mistake that we do is what? We give them a solution without really understanding the what and the why. So often I actually sit down with mum at the beginning of the consult and say, look, Sarah, what I usually do with every consult is to identify what is the problem, Why is it a problem, and how can we improve it? And actually, I share with them that one of the mistakes that most of us doctors do is to jump in and try to solve the problem without knowing the what and the why. And then what I say to them is that, do you think we can focus on the what and the why today? How does that sound to you? And they usually say yes. And when they say yes, it releases that pressure from you to jump in and try to improve and come up with a solution today. And it just get you to focus on this, because this is about curiosity. When you try to solve the problem and you don't have a solution, what happens? You get stress. And when you get stressed, you're not going to focus on the what and the why. So this is diagnostic and this is management. Okay, so what is the problem? So how do you define what the problem is, besides taking a history from Sarah there? What's another way of actually getting a definition of what the problem is? Because if you get the wrong definition, you're going to get the wrong solution. So how do you define what the problem is? Ask the patient, yes?
What is going on?
Yes. Sometimes they may say things like, where they think it's a problem, but actually it may not be the problem at all, because it's actually their perspective. So how do you sort of get sometimes I call this the 3D picture of the problem. So imagine if the problem looks like this, and Sarah comes along. Sarah only tells you her perspective of the problem, isn't it? So you say, okay, no, the problem is a rectangle. And if you ask who else? Ask Dad. Dad will say, what he will say? No, it's actually a square. And then somebody else will say, no, it's actually some funny figure with a sort of a Mercedes sign in the middle. So one of the things I actually tell mum to do is that what I want to see is a 3D picture of this problem, a holistic picture of this problem. So what I do is actually get mum to go home and do what? Write down a list of problems that she sees as the problem. And then who else do you tell her to give you a list? Dad. Okay, who else? Teacher. Very, very useful. Who else? Sometimes? Yes, okay. And sometimes the grandparents. And that's actually very useful, because what you want to see is not one perspective. You want to see a holistic sort of a 3D picture of the problem. Does that actually make sense? And most of the time, if you explain this to them, they actually understand. Another way of explaining this is if you go into YouTube. I actually don't know who actually did it, but it's actually very useful. They draw something like this. And then if mum looks at the problem this way, she'll say it's a triangle on the left and a cross on the right. If you ask the school, they say a square on the right and a circle on the left. And the reality is that all those perspective is correct. And all the perspective make a full picture. Sometimes you just get two perspective, and that's probably okay. All right, so any questions about that? So that's what I usually get them to do after the first consult. Go home, get this information, and they'll come back to the next consult with a letter from the school, a little note from grandma, a little note from dad, and you can quickly see where the issues are. Now, what happens, do you think, if the school says, the child's wonderful, and dad says, there's no problem, and grandma says, I can't see a problem, and mum says, I've got lots and lots of problems? What do you see there? What can you sort of deduct from that already, just based on that?
They're very different perspectives, maybe different expectations.
Yeah, or there's an interaction issue between mum and the child, so it's something to do with, whereas if it's more to do with the child, what do you expect? Yeah, you'll expect it to be consistent right throughout all those perspectives. Okay, so when it comes to the why, how do you sort of have categories for why, with any child's behaviour, or any time parents come in and say, look, I can't cope with my child, then the question is why. So what factors do you look at? What factors here that you look at that is contributing to the child's behaviour or mum not coping with the child? How many children? Yeah, okay, so that's environmental factors. So if I usually divide into 4. So that's more environmental. Can you all read this, by the way? So environmental. So as I sort of, the reason why I'm actually doing it this way is that when I do the consult, I actually have a piece of paper in front of them, and I actually do this in front of them and having this conversation, and I actually will give them this piece of paper when they go home. So the first one is environmental. So environmental factors are like schools, teachers, other siblings, and what else? What's the most important out of here? The parenting style. So I actually don't call it parents because I'm mindful of the fact that sometimes parents are very self-blaming already, and I actually tell them it's your parenting style. And then I'll back it up with that you might find that one parenting style works great for these 3 kids, but then the same parenting style may not work for another child. So then you might have to sort of reflect on that and say, is there another style that I can use for this particular child? So what's the sort of the opposing factor of environmental, do you think? The child. So the child, we call it the child's what? Child's personality or temperament. Can you change that? Can you change their personality? Can you change your personality? Okay, so a lot of the times we often believe that you can't change someone's temperament or personality, but what you can do is actually understand it and actually work with it. So then that's the temperament. What's number 3, do you think? This is actually something that's important that you guys need to do. What's number 3? So you've got child's personality, you've got the environmental factors. Social, so that's probably more environmental, probably very environmental. What type of disorders? Yes, okay, so I'll probably put that number 4. Apologies. I'd probably call it under mental health. Because were you aware that, that autism, ADHD, ODD are all on DSM-4? Yeah, so mental health, I probably put down the bottom there as things like anxiety, depression, so a little bit more severe end, autism, ODD, ADHD, etc. So what's the opposing factor for mental health is physical. So what kind of physical health are you guys looking for here that can have an impact on behaviour? Hearing loss, sleep, visual, auditory processing, what else? Chronic disease. What's the one thing that we often miss in general practice in kids? Developmental, yeah, so that's, okay, so developmental is probably child personality as well, yes, if there's physical delays, etc. One thing that kids snoring, grinding their teeth, what are you looking for? Sleep? Sleep apnea. So sleep apnea is actually one of the things that we often miss in general practice. Imagine a child, if you ask, is he grinding his teeth? Is he snoring? Have you noticed that he's stopped breathing when you go on a trip with him, you sleep next to him, or he wakes up feeling really tired, or actually witness apnea, or allergies and mouth breathing, etc. So I think that's one thing that, particularly in adults as well, if you have someone who have depression, anxiety, I think one of the things you have to rule out is organic problems. And one of those organic problems is actually sleep apnea. And grinding of teeth is actually one of the symptoms of sleep apnea as well. So if you ever sort of refer anyone for sleep studies, they'll actually ask you about things like snoring, teeth grinding, which is something that most of us are actually not aware. Okay, does that make sense? Okay, so now when I actually write down these things for parents, I often actually ask parents, which one of these factors do you think is relevant for you? So when you do the sort of like the more health coaching approach, you'll take away what, do you think? Probably, sorry, your name there, sorry, before you're worried about parents being sort of either defensive or feeling upset by implying that you might be blaming them for their parenting. So when you actually ask them, this is actually one strategy to get around that. If you say to the parent, say, okay, what do you think is relevant here for your child? And if they say to you, I think it's my parenting style, then you're taking away that blaming, because it's actually them that's coming up with that solution or that awareness. Because if you say to them, a lot of the times you probably have an idea already, that's the main issue. And if you go straight into that, what's going to happen? They're going to get defensive, and you've probably lost that relationship. You lost that empathy. Whereas if you do the coaching approach, it comes out from their own awareness. You'll see that the defensiveness is not there, and you actually get a buy-in from them. They say, "Okay, I'm willing to do that." Okay, so often you'll find that parents will often say which one's the most likely for them. Do you think? Yeah, it's common in general practice that they probably recognise that, no, it's actually my child's temperament and it's probably environmental factors. Some will say, no, I think my child's got autism. But a lot of the times I often, particularly if it's grey, I think the most important thing for us as GPs to do what? Even if you refer this child away, what do you have to do first? Rule out this one. So you need to check their growth, you need to check their development, you need to check their hearing, you need to check sleep apnea, all the physical stuff. Because if you refer them off too early and you haven't checked those things, then sometimes we'll see kids who've been diagnosed ADHD, in actual fact, they have sleep apnea. And when you actually treat their sleep apnea, a few years down the track, you'll find that a lot of their symptoms actually improved. So that's actually the job, probably the most important job of the GP, is to rule out any organic problems. The same way as when you refer someone away for psychological counselling, what do you have to do? You have to rule out physical disorders. Okay, so when, say for example, mum says, okay, it's actually I think it's my parenting style, interacting with the child's temperament, then I often will say to a parent that, okay, do you think we can change the child's temperament? And they often say no. And then we can say then, okay, well, how about we work on your parenting style? How does that sound to you? And when they say yes, you've got to buy in. So then when you have the buy-in, that's your next consult. So that's how that's my framework. So the initial framework is really about getting this bit, psychoeducation, acknowledging, which you've done very well there, John. And then I get them to be motivated, give them hope, give them a bit of structure, and get them to buy in to this. So then by the next session, they're going to come back with a little bit of collateral history from school, dad and grandparents, and they are already bought into the fact that I'm going to do some parenting stuff with you. Okay? Any questions? Sorry.
If a patient comes in with this scenario, I think I would spend much time on the mom.
Definitely. Yeah, so I agree. So that's why I sort of preempt at the beginning to make sure there's safety, etc. Because if you you may have to make sure that she doesn't have depression, anxiety, and you have to deal with that. So a little bit of an artificial, because today is actually more about parenting. So let's assume that you've done all that and make sure that mum is safe, etc. Because then giving her the tools to do this will help her with her stress. I guess that's probably the essence of today's workshop, is parenting education is actually very important to help mum with their stress. And sometimes this mum may actually end up with an antidepressant, and that may not be the appropriate answer. The appropriate answer may be just work with this. Okay, and you probably, from that little bit of history taking, John, what's the other things that are sort of red flags there as well? So it's not just parenting that's causing this distress. What's the other thing that's causing this distress? Yes, the relationship. And that's actually very, very stressful. So with this mum, I actually would probably do this. I'll probably do relationship stuff. I'll probably do family stuff. And I'll actually check out all her thyroid and B12 folate, etc. So I'm really taking this case, a little bit of the case out. Whereas, as you can see, it actually probably requires a bit of family therapy. Okay, so if I can just rub that out. Okay, so if they come back the next week, and you'll find that if if people have a little bit hope and a little bit direction, you'll find that they'll actually feel a little bit better, because they, being in limbo and not knowing what to do will give them a sense of hopelessness. Whereas if you sort of give them an understanding, acknowledgement and support and compassion and a bit of direction, they actually feel a little bit better. Okay, so when they come back, assuming that you assess all the issues and make sure that it's partly sort of parenting, partly child, and let's assume that sometimes I go straight into that because I want to give them some strategies to work straight away and then sort out all the physical issues, but you may decide that you want to deal with the physical things first. But again, for the structure of this talk today, I'm going to focus on the parenting part. Okay, so with the education and parenting, I often will then sort of sit down and often will get two parents to come in, ideally. And why is that, do you think? Yes.
Sometimes could have the benefit of patients seeing
Yes.
each other's perspective.
Yeah.
They wouldn't otherwise have seen.
Sure. Okay. So that's one thing, and the other thing is actually in this. If you're actually doing this, you actually help with their relationship as well, and you're actually reducing the stress from the relationship because you're aligning their goals. So often I actually get both parents to come in, and the other thing as well is that part of changing behaviour requires 4 steps. Does anyone know what they are? 4 steps to changing behaviours? Yes, so that's I generally use a slightly more simpler term because I'm actually not that clever. So I actually call it awareness. So the first step is awareness. Awareness that, this is what's happening. The second step is awareness will give willingness, I think. Yeah, so then the next step is you need to give them the tools. So you give them the tools and give them the resources and the support. And what's the third step? So most people have awareness, most people have the tools, but nothing is changing. That's probably the tools. So the next step is to apply it, action it. So you need to apply it. And not just ad hoc, you need to apply it consistently before it becomes a new habit. And that's where the problem is. So often I find that if I get both parents to come in, they will be each other's coach. Because if you find that you're just working with one parent, they will probably do it all incorrectly, apply it incorrectly, and then you see them 2 weeks later and you sort of have to backtrack. So where if you have both parents on the same page, you align their goals, you give them the same tools, and then you actually help them to say, hey, I'm going to get you guys to coach each other. And the condition is that you don't get defensive, because this is just you helping each other change. So that's actually one reason why I actually get them to actually come in as well, both. Okay, so then what I do is I actually work on them both. And I often say to them that with any skills, there's 2 components. The first component is what I call the how and the what. And most people, when they go to a workshop, they're actually really interested in, well, what do I have to do and how do we do it? Isn't it? So that's what we call the what, the how and the what. So basically tools, essentially. But what's the most important, do you think? What's the most important in, well, I feel anyway, personally, it's not so much the what to do and how to do, but what's one of the most important thing? Why, or the mindset? The mindset is actually very important. So imagine if you go into Australian Idol, you can actually sing very well, but you haven't got the right mindset. Apologies. You haven't actually got the right mindset, so it still doesn't come, it still doesn't actually come through correctly. So what I'm going to do is that in parenting, I often sort of work with them on this mindset first. Now, in the mindset, I actually, we can call it schemas or we can call it mindset. And I actually sort of create this little term, just a bit of fun and games, just so that they can sort of remember it in a way. So I call it the onesies. Have anyone heard me talk about the onesies, 2Zs and 3Zs before? No? Okay. So this is what I call the mindset. So each one of us actually go through these mindsets all the time without even actually knowing. So rather than thinking if this is good or bad, think of it more like gears in the car. So one, two, three, one's not necessarily better than two or three. It's actually about being in context. So when I talk about onesies, what does onesies usually mean? So in schemas, they call this entitlement. Really, I see it as more of self-preservation mode. So onesie is like this. If you don't care about me, you don't do things my way, you don't love me, I'm going to chuck a tantrum. So that's a onesie mode. Okay, so if you have children, what are they usually? Are they onesies? Yeah, if you have to deal with children, they're onesies. A lot of your patients, when they come in distress and they're upset, what are they? Are they usually probably onesies? Does that sort of make sense? Okay, so onesies are usually in children, but it's actually also in adults who are what, do you think? Or stress. When we're under stress, we go into onesie mode. So if you find that, say for example, one of your patients has a onesie mode, they come in, you're running very late, and they're really, really upset with you. And if you're a onesie as well, what do you think will happen? Sorry? Nothing good. You'll actually have a war. So often this is what we call onesie, and a onesie equals a war, isn't it? Okay, so I just want to highlight that for you there. So what do you think is a twosies then? Twosies is a different schema. Twosie is what I call justice. It's about fairness. You know, I'm nice to you, how come you're not nice to me? I'm nice to you, you need to be nice to me. I do this for you, you need to do this for me. It's very transactional. So that's a twosie mindset. And in business, you'll see a lot of this twosie mindset going on. Now, if you have a twosies and a onesie, what will happen, do you think? Yeah. So you still have a war, isn't it? So I guess what happens with the twosie mindset is often if you have a onesie and you have a twosie mindset, it means that if you treat me like a onesie, I'm going to treat you back like a onesie. So usually a twosies and a onesie mindset doesn't really work very well in conflict, and particularly in parenting. In parenting, what happens here is that a child's a onesie, and if mum is sleep deprived or dad is sleep deprived and their needs are not being met and they're tired, what happens? They become a onesie. So you actually see the dynamics here going on is that you have a onesie and a onesie, and it'll just escalate and it'll become problematic. If mum or dad is a twosie mindset, you're also going to have a problem because you actually have a onesie in front of you, and it will escalate, it will be a problem. So what's a threesie then? In parenting, we often say to people to switch to more of a threesie mindset, or at least a 2.1 and above. So what is the threesie mindset then? Sorry? Altruism? Yeah. I'll care about you no matter what. I have compassion for you no matter what. I have unconditional positive regard for you. So that's a 3Z mindset. And nobody can be a 3Z mindset all the time. In actual fact, a lot of doctors have what I call the 3Z wannabe mindset. Isn't it? That's our self-sacrifice. We want to help people. We gain our significance from helping people. The problem here is this, is that if you want to be a 3Z all the time and you don't self-care, what's going to happen? You're going to have burnout, yes. So you'll see here that these are like, again, gears in the car. You can't stay in one gear all the time, in a way. For you to be a 3Z, you need to be 3Z to yourself. And I can tell you that, I mean, one of our area of interest is actually self-care for doctors and health professionals. And what I find is that a lot of doctors are sort of 3Z. They want to be 3Z, but they actually often are onesie to themselves. They're actually very self-critical a lot of the times. And that's a pattern that we see. Okay, does that make sense? So I often will help parents to understand that if you are onesie or twosies, particularly when you're dealing with your kids, you're going to run into trouble. If you switch to a 3Z mode by using awareness, using cognitive challenge, I guess, is where you say, Johnny or Tyson, Mummy and Daddy loves you no matter what. At the same time, this is a rule, and this is what needs to happen. If it doesn't happen, then this is the consequence, so to speak. So I think this is probably the mindset that we actually at least raise that awareness for the parents. In medicine, when you're thinking about your own work, what happens when you're onesie or twosie at work and you're dealing with a patient who's very demanding, who's more of onesie? What do you think will happen? Probably conflict. So the same principle applies, I guess, in general practice as well. And maybe I'll do that talk at a different day. But today, if I can just sort of highlight this to you and see how you can actually apply it into parenting and just raise the mindfulness of parents to say, okay, am I onesie, twosie, or threesie? Okay. Any questions? Okay, so the next step is, once I sort of raise that awareness, I actually talk to them about the tools. So in parenting, there's only really two tools. There's actually what we call connection, and the other one is what, do you think? One is about connections, about relationship, and the other one is discipline. Yeah. Or sometimes we can call it coaching. Okay, so if you guys, one of the things that later on, if you guys want to explore this a little bit further, in general practice, there's a few sort of courses, parenting courses. Have you ever heard of Circle Security? Circle Security? Yeah, so Circle Security focus a lot more on mindset and connection. Whereas Triple P, and there's one that's called 1, 2, 3 Magic, focus a little bit more on the behaviour. So they focus more on this. So a lot of the times I use what I call a more eclectic approach. If a child have really bad relationship with the parents, and sometimes you even recognise that there's a problem with attachment or a problem with their relationship, which one do you think I use a little bit more? Which one do you think I need to focus a little bit more on? Connection and mindset. Because you need to give your children unconditional love, so to speak, and help them to perceive that. And then you actually build your connection. Whereas if the child has great connections with their parents already, then you might actually focus a little bit more on the behaviour, on the discipline. Okay? So, connection. How do you actually show connection with your child or help them to perceive connection? So this is a very CBT sort of thing. Have you guys done a bit of cognitive behavioural therapy and understand sort of some of the principles behind that? Okay. So how do you perceive connection, do you think? Similarities?
Exploring similarities. So
okay.
Similarities in perspective,
yeah.
behaviours.
Sure. Okay.
I think with children it would be, I like the same things as you.
Sure. Okay. So connection. Okay. Anything else? Time and attention. Yes. Okay. So think of it like in your subconscious, some of you actually are more focused on time. So when you care about someone, you spend time with them. Or when someone spend time with you, you actually feel that their presence or their being there with you as a measure of, hey, you actually care about me. So this is actually happening at a very subconscious level. And you'll find it comes down to personality as well, is that the one who's more emotionally intuitive are very time-based.
Say like active listening.
Active listening. So when you're active listening, you're really spending time with them. You're actually being there with them. So that's probably time. What's another way? Doing things for people. So that's, yeah, so being of service to others. So usually the more practical personality are usually more service orientated. So they have a belief that if you love me, you care about me, then you do things for me, you support me, you train me. Okay, another way? Sorry? Gifts, yeah. So in the general practice room, if a child doesn't like you, you give them a lolly, suddenly you become their friend. So then that's gifts, yes? So this is a reflection of beliefs here. So some of you might have known these items already. So what's number 4? Physically, yes. So physical, yes. And words. Okay, now there's probably a few more because different people have different belief systems. For some people it's loyalty and trust, but you'll find that these are the common ones. These are the common ones. So ultimately from a CBT point of view, from a cognitive behavioural point of view, this reflects our belief system and our personality. So what you'll have here is that sometimes you can actually figure this out through their personality. So if they're practical, they're more, thanks for that. If they're actually more practical, they're very service orientated. If they are proud or if they were raised up in a hypercritical environment, which one do you think they are? Sorry? Verbal, so words. They need words of affirmation. If they are very emotionally intuitive, they can be more time orientated. So you'll see here in this room, you probably have a mix. Some of you are words orientated, some of you are time orientated. So we actually have all different values and beliefs, and we all connect in a different way. So say, for example, later on, if you were a service person and your supervisor is a words person, then you may sort of mismatch. He may not support you as much, but he always gives you praise. Then it may not do the trick. Does that make sense? Or in parenting, sometimes I see kids who are very time orientated and the parents are very service orientated. So then there's a sense of disconnection. So in Triple P, if you ever do Triple P, they say it in a different way. They say, gives hugs, kisses, give quality time, frequent quality time, not sort of 5 hours a year at the Gold Coast, but actually just frequent quality time and attention. They'll say, do things for your children, teach them, train them, help them. Gifts, but just be careful, don't overdo it. And words, so praise them, so descriptive praise, or praise them on effort. You know, sometimes we talk about praising effort rather than praising if they're smart or not. Because if you praise them that, hey, geez, you're very smart, you really subconsciously sometimes tell them that you're significant because you're smart. If you're not smart, you are maybe not significant anymore. I love you because you're smart, but if you're not smart, you may not get my love anymore. So just be careful with that one. I think most of us were raised up on, if you reflect, how do you measure your own self-significance? Is it by achievement? If I achieve, I'm significant. If I fail, I am insignificant. So most of you have been conditioned that way, but you're probably not even aware until today. Now, if you're conditioned that way, what do you think will happen? You will have a fear of failure. Whereas if I have the belief that failure is great, failure means I'm learning, I'm growing, and I'm actually learning every day, then I'm not going to be so fearful of failure. So you'll see here you've actually been conditioned that way, probably by society, by your own self-talk, and probably your parents. But don't blame them because they probably have the same belief system as well from their parents and then from their parents. So part of this sort of parenting work is actually help them to understand their inner world. Okay, any questions about that? So we often say to people, work on this connection. So how much are you doing this? And actually help them with our own relationships. So I often ask the couples as well, mum and dad, I actually ask them, when you first dated, how much of these things did you do for each other? And the common answer is all of them. Yeah, and then you say, well, how much of that are you doing now? And they often have a laugh and say, probably none of them, or not much. So that applies to every relationship, really, whether it's actually at work. Now, at work, which one is more relevant at work, do you think? If your supervisor, so physical is probably just high fives. Time is just having a coffee or maybe just at the lunchroom. Service is support. If you need help, we'll give you support. Gifts, maybe a bonus. And what's the last one? Words. So words of acknowledgement. If you had a hard day, you can actually say, geez, you had a hard day, but thank you for trying so hard today. So that's actually more words of acknowledgement. So the same applies in all relationships. Okay. Any questions about that until we move to the last one? So we've got about 10 minutes to talk about discipline. So often I'll get mum and dad to actually really focus on those things, getting the mindset right, getting more of the 3Z mindset, and actually even say it out loud, is that, Tyson, mummy loves you no matter what, before they start to tell them what to do, etc. So help them to get into that mindset. And number 2 is make sure they're doing all those things, the connection, and make sure that sometimes you can actually figure out which one your child is. So for those of you who are parents, you can actually figure out which child is more physical, which child's more wordy, which ones that actually don't really care too much about words. So you actually work out which one it is.
In your experience, do children tend to express affection in the same way that they need to have it expressed back to them? Like, so a child who requires physical affection, do they tend to be the cuddly child, or is that not the case?
I actually put, they usually, adults may not be. Adults may not, because over time, because there's conflicting core values. You may have a value of, I love giving gifts, for example, but then you have another belief that taking gifts is selfish. So then, even though you might want it, but that value of taking gifts is selfish may actually mask that. So you still give it, but you actually don't like receiving it. Although deep inside, you probably still do. Okay, so human beings are actually not that simple. There's actually multiple core values that is in conflict with another. And a lot of the times they're all of them, to be honest. But you'll find that they're actually predominantly one or the other. And if you actually look at your own self, the more logical amongst you will probably be more service-orientated, and the more intuitive amongst you are probably more time-orientated. And same with husband and wife. If one was service and one was time, what will happen, do you think? Over time, there's this disconnection, because the husband will work 7 days a week, or sometimes vice versa, and the other person needs time. And then you actually have this disconnection, and you actually don't know why. So that's actually a very subconscious thing. Okay, so a lot of the CBT is actually working on that, actually help you understand what's in your subconscious mind, what's your values and beliefs, and then you actually understand how you're feeling so that you can actually change it if you want to change it.
Is it ever too late, like for a child that's now in their early teens and having disconnect with both parents?
Yes.
And also the parents having a disconnect,
Yes. No, so obviously the earlier the better, but actually not necessarily. So sometimes in general practice we often see people at crisis point. And crisis is an opportunity for change. Often if you do it sort of too early where it's not a crisis, they're not that motivated to change. If they hit a crisis, maybe there's an opportunity to change there. If you leave that too late, it can be a problem. So it's a bit of a, sort of depends is the answer. So often we like to start early and give people the skills early, and then even when they have crisis, if they actually have the skills already, then they can then hopefully apply it. Does that answer your question? Yeah. Okay, we've got 5 minutes to talk about discipline now. So when I talk about discipline, I often ask the parent connection versus discipline. And I actually often find that one parent will be one more biased towards one, and the other one is towards the other. So then I actually usually ask parents, which one do you think is better? So how about if I ask you, which one do you think is better? Discipline or connection? Yeah, okay. Well, the reality is that child needs both. And in actual fact, if you have too much connection and no discipline, what do you think will happen? They'll get spoiled. If you have too much discipline but no connection, they will rebel eventually when they sort of have some power to rebel. So then what I actually do there is I acknowledge both parties and actually help them to stop blaming each other, because that actually works against things. And often they actually understand this. So then you'll find that mum or dad can be one and then the other. Okay, now the discipline I often highlight here is that what's the common pitfalls for parents with regards to discipline? Not consistent, yes. That's actually one thing, yes. I'm very guilty of that. What else? Encouragement. Yeah, more punishment than encouragement, yes. So not sort of catching them out when they do things well and paying more attention to problems rather than more attention to good things, yes? Yes, well, yes. And then the problem, yes, so the problem with discipline is a little bit of an art form, actually. It's like a little bit of a dance. In actual fact, my personal bias is that if you don't know which one, go for connection. And then you can build the discipline on top. You can always sort of reverse that to some extent, whereas the other one, once it's disconnected, it's actually quite difficult. Okay, so one of the two common ones that I actually talk about is accidental rewards. So what do you think that means, accidental rewards, which all parents do? I'm still doing it, even though I'm more aware of it now.
Unintentionally giving a reward.
Yeah, so if they're chucking a tantrum in the shopping centre, what do? You give them a lolly, or you do something, you quieten them down. If you have guests over and they're having a tantrum, you give them the iPad, or you're actually rewarding them for a bad behaviour. So that's called an accidental reward. So most parents will have a good laugh about that because, however, I think a lot of the times I often preempt it by saying, I do this all the time. Even though I'm aware, I'm actually still doing it. I'm actually doing it less than what I did last year, but I'm actually aware of it. So that it just gives them that permission that they're not being judged. And what's the other one? Is sure, so unclear instructions. So maybe unclear instructions. And the common one I think parents do is telling them what to do with a question. Like, can you clean up your room? And they say no. What are you going to do? You're going to escalate. So sometimes probably the unclear instructions can be a problem. And we learned that just from being social, I guess, as an adult. But that's not what we really mean, is not really asking a question. We actually tell them what to do. Okay, the common one is escalation trap, where what happens here is that you tell them what to do, they say no. What happens? Parents escalate, then child escalate, and it just escalates and becomes a big war at the end. And often parents will cave in, or the child wins. Or sometimes the parent actually sends them into the room and actually give consequences and punishment. Okay, so what in that situation, what is the child learning if it's actually escalation? What's the child learning from that process?
They're allowed to start arguments.
Yep. Or mum's not serious until she gets to here. And what are we learning from that as a parent? That they're not going to listen to me until I escalate. So if that is what you're learning and that's what the child's learning, it'll just continue. So often I actually just point out to those two common mistakes, and people often actually recognise it. So then how do you stop that from happening? So in Triple P, they have what we call, there's a number of strategies. There's quiet time and time out. But I actually like to use the 1, 2, 3 magic. I actually don't like the term very much, but nevertheless, actually I find it very useful. Has anyone heard of 1, 2, 3 magic? Yes? No? Okay. So how I explain 1, 2, 3 magic is this, is that I'll explain to the mum that, or the parent, that basically we have an old brain and a new brain, or sometimes we call it the downstairs brain and upstairs brain, or the limbic brain or the reptilian brain versus the neocortex. And what happens here is that when that happens, they're actually using their old brain, their reaction, their fight or flight response. So when I actually, say for example, if I ask the child to do something and they already know that the rules is that they need to follow those rules, then what I actually get parents to do is to say to them, sweetie, that's a 1. Now that's a 1 is not a threat. It's actually a reminder for them to use their neocortex, essentially. They use their new brain to actually reflect and say, hey, am I going to do this or not? So if they actually don't do it after about, say, 2 or 3 or 4 or 5 seconds, you can say, sweetie, that's a 2. And so the method of delivery is actually most important. You can't say that's a 1, that's a 2, because when you say it as a frustration, that's actually an escalation trap. When you say it in a calm, loving, compassionate way, as a reminder, it's actually a different story. In actual fact, what you're teaching them is how to self-regulate, how to stop, think before they react. So it's actually thinking it through. And if they actually don't follow after the second go, then you can say, sweetie, that's a 3, and you actually have to go to your room for timeout, 2 or 3 minutes. Some parents will actually get them to write a page of things like, I'm too cool to swear or something like that. So every family culture is different. I generally like to sort of gauge what the family culture is and actually working with their style of, I guess, consequences. But the ultimate thing is make sure that you deliver it in a compassionate way, in a more 3Z approach. If you deliver consequences in a 1Z approach, it generally is called a punishment. If you deliver it in a 3Z approach, what is that called? It's consequence. So if you do it in a neutral way or a compassionate way, it actually will come across more as a consequence. So that's really in a nutshell. I'm hoping that, we can sit here all day talking about all the different methods, etc., and then role play that. But what I'm actually hoping to do today is give you a bit of a framework and maybe a little bit of appreciation of how parenting work can actually help parents with their stress and their own relationship. And hopefully I sort of ignited some interest in you to actually go and do some triple P or 1, 2, 3 magic or circle security, and even just have an idea of what services around you that can provide this and actually do appropriate referrals for them, rather than maybe sometimes this mum, for example, may actually even end up with an antidepressant and without any parenting support. And antidepressant is not going to fix these problems. Does that make sense? Any questions? Yes. Sorry, John. Yeah.
I just have two questions. One, firstly, is just with regards to, so it's just great that parents sort of come in and wanting to actually talk to you as a GP about this. What about parents who come in and say, my child's having tantrums, school is, putting pressure on me, I want to see a paediatrician because I think, there's ADHD.
Yes.
And there's already a, sort of a background in the mum or dad
Yes.
diagnosis.
Yes.
And then, how do you then try and turn it around to be able to talk about this stuff?
Sure.
If they
Okay.
come in and say they're having tantrums,
Yes.
they've got ADHD.
Okay. Yeah. I would use the same approach. I will actually sit down with them and actually will say to them, this is actually how I approach it. The what, why, and how can we improve it? And actually in the why, I will actually say, well, how much is the child's temperament? How much of it is environmental? How much of it is due to physical disorders? And how much of it is due to mental health? And then I'll actually say to them, if you believe that this is 100% due to a mental health disorder, then that's when I'm going to refer you to the paediatrician. But if you believe that there may be issues here that we can actually work on, then I'm actually very happy to work with you on that. And if the parents say, no, I'm definite that it's just ADHD, then refer them. But then say to them that at any time where you actually feel that there may be these factors here, which I personally believe there might be, then come and see me and book a 40-minute appointment with me. So rather than resisting that, I would actually just educate them, give them the information, and say to them what you want to do. So I actually have many of those, actually. And often they'll say, look, okay, doc, how about we do this for the next 2 or 3 months and see if things improve? And if it doesn't improve, then I'll see the paediatrician. Because ultimately, for you to diagnose, say for example, if a child has ADHD and you sort out their sleep apnea or nasal congestion, and you help parents to work out some of their behavioural issues and things get much better, then do they fit the criteria for ADHD anymore? No. If someone has Asperger's, but they're very well functioning and there's no problems, do they have Asperger's anymore? No. So that's the problem with the diagnosis of things like ADHD and Asperger's, etc. It's very arbitrary. It comes down to their functionality. And in actual fact, you'll see in our medical profession, some of our colleagues probably fit those criteria. But if they're well functioning, they're happy, and they're actually working in the environment, we actually don't call them that. We just call them a genius or someone really, really good at what they do. Yeah. Does that, yeah?
Yeah. And sorry, I just have
No.
a question as well. Just from a practicality perspective, implementing this into GP, into general practice, how do you do this? Like,
Sure. So you can, yeah. Sure. So one of the things I often say in general practice is that how much time do you have with a patient in general practice? Sorry? Yeah, 15 minutes. And I think that's most of the belief of medical students and guys from the hospital comes out and say, in general practice, you only got 15 minutes. In actual fact, we have a whole lifetime with them. And every time we finish a consult, it's just a pause. I can see them every day if I want to. I can see them every week if I want to. So a lot of the times with these things, I actually see them, if they only can stand for, can hold their attention for 20 minutes, I'll see them 20 minutes every week, every 2 weeks, for about 6 sessions or about 10 sessions or about 12 sessions, and let's just go through that and help them through those 4 steps: awareness, tools, application, until it becomes a habit. Whereas if you work in the hospital, you only get an hour or 2 hours and then you discharge them and you never see them again. But in general practice, that's a different story. And I think if you have that awareness that you actually do have a whole lifetime with them, you're not going to be stressed about trying to fit everything into that 20 minutes. So I often do it 20 minutes, 30 minutes, 40 minutes. I often do it in 40 minutes. And there's item numbers for that. If you actually do the focus psychological strategy item numbers, there's actually item numbers for parenting, education, etc. John, I think you had a question before.
So, I'm sure I can look into one system magic and find out more about how they would roll this out. You're saying, if a child is exhibiting a behaviour that you don't like, you would remind them that's a 1. Do you have to, before, explain to them why it's a 1?
Oh yes, so apologies. I sort of did that in a very short cut. Often you actually have to sit down with them and actually explain and coach them beforehand and say, little Tyson, we've got a new family rule here. And you sort of go through that process and educate them what a 1, 2, 3 mean. And then I actually will coach them. I'll say, Tyson, so if you don't follow instructions, what's Mummy going to do? And he'll say, that's a 1. So then you actually just coach them through that rather than just spring it on them, which is probably not good. Okay? One thing, actually, 1 more minute, is that one of the things that if you guys are actually interested, Wayne and I, with a few of other health professionals, start up a closed forum, Facebook forum called Health Pro Exchange. Any of you guys are on it already? And what I'm hoping to do is that if you guys are interested, you can certainly ask any of us on there any questions about anything really, general practice, business, anything. And we actually have not just GPs, we actually have specialists as well as psychologists as well as OTs, allied health on there. So it's used to support our own self-care. But if you actually have a question about parenting, or the other day I had a guy with transgender issues, and that's just not my area of expertise. I basically ask a question there, and I quickly see that there's a number of other GPs who actually deal with these issues. So I might just see if I can give out a card to you guys. Is that okay? And if you can grab one of those, it's just a closed Facebook forum. Just identify who you are so that I'll know or will know to let you through. Okay?
Thank you very much for that informative talk,
Yeah,
Dr. Tran and
Yeah.
Wynne. We're just going to thank you
Okay.
present for you both.
Thank you very much.
Thanks very much.
Thank you very much.
Can we give them all a round of applause?